Right now there's a crisis in this country, a financial crisis, and that's people who don't have insurance or who are underinsured going bankrupt from medical bills that they can't afford for procedures that they needed, and doctors also going bankrupt from outrageous damage awards and malpractice lawsuits. And what I think is needed is a single-payer government-run healthcare system similar to what I've had for the last 19 years in the military, called TRICARE. During that 19 years, myself and my family have received excellent care, and I've never had to pay one medical bill because of it. Never had to taken a chance on going bankrupt because of medical bills. All active duty get this, and I think it could be extended to the whole country. Right now, there are runaway juries in America, and people are going to the poorhouse trying to pay medical bills that are actually covering the cost of malpractice insurance for doctors. Right now, the well-insured, they pay inflated costs because of these awards, and the working poor often go without insurance because they can't afford it at all. This includes children, and this includes people that are working 40 to 60 hours a week at jobs who can't get benefits from their company. Medical bankruptcies are on the rise, and one single procedure, operation, hospital stay could bankrupt an entire family. This is wrong. These costs are rising because of the need to pay for these outrageous damage settlements. So we have a two-headed monster there, the underinsured and the outrageous litigation that's going on in this country. I think that the way to combat this debt spiral and this lack of care is the single-payer system I talked about, similar to TRICARE or Medicare. Right now, I think this kind of medical system would stop medical bankruptcies and denied care. It would certainly put a cap for damages with tort reform and give you the same medical care for less cost, and that's the key to the whole system. And one thing I don't understand in this country to think about is air traffic control, law enforcement, firefighting, national defense. All this is paid for by the government, but for some reason the basic human need of medical care is not. And I don't understand why we provide children police protection and national defense and don't give them health coverage. A lot of times when a system like this is brought up, critics are going to say that this is going to lead to a degradation in health care, that our medical system is going to suffer. You won't be able to get this level of care that you get in America now if you can afford it. And I bring up the example of Hawaii, who in 1989 they started a state-run healthcare system, and they love it, and they've received no degradation in the level of care they receive. Just now everybody's covered. The state is basically one big HMO. I would also look at Canada. They have a national Medicare system that covers everyone, not just the old, and they have an 80 to 90% approval rating for their healthcare system. Whereas in America, with our free enterprise system, we have about a 70% approval rating. Another thing to look at is England's National Healthcare Service. It has great approval ratings and an excellent level of care, and world-renowned physicist Dr. Stephen Hawking, who suffers from a debilitating muscular disease, said that he would not be here today if not for the National Healthcare Service. Now, I know 3 to 5 minutes is not enough time to outline every cause and every effect and every solution for a problem this huge, but I hope I've shown how the two-headed monster of lack of health care coverage and runaway juries is devouring America's financial system. And I'd also like to remind everybody that that cost is being absorbed by you and me, the consumer. Thank you.